right, hello. My name is Yuliana Alcaraz. I am the Director of Infection Prevention at Metropolitan Methodist Hospital in San Antonio. And together with other quality team members, we worked on a project called Putting the Drop on Blood Culture Contamination in the ED. All right, so for background, we know blood culture contamination can lead to unnecessary antibiotic usage, increased length of stay, and increased cost to patients or the facility. Our hospital wanted to focus on lowering contamination rates for this reason. We first started a plan to lower rates in the inpatient side, and we were very successful, so we decided to do the same project in the ED. So I will be describing phase 2 of the project, which was to lower the ED contamination. So the project started September 2022 when our ED rate was observed to be over 6%. Based on the American Society for Microbiology and Clinical Lab Standards Institute, the recommendation is for contamination rates not to exceed 3%. So we decided that 3% will be our goal. Our methods included developing a task force and involving senior leaders for support. So our task force included lab representation, ED leadership, education, quality members such as myself, IP, risk management, and sepsis. First, we reviewed our current process to understand our opportunities for improvement. Then we developed a plan to implement one intervention at a time based on our findings. As we were implementing interventions, we used a series of plan, do, study, act cycles to determine modifications. So our interventions were as followed. Our PDSA 1 was focused on supplies. So we noticed issues with chlorhexidine availability and use among nurses. CHG, or chlorhexidine, is used in the emergency department when patients are visibly soiled. And so the expectation is for nurses to do a wipe down prior to blood culture prep. So since we saw opportunities, we installed a new CHG warmer. We placed it in a very common area, and we had a CHG representative conduct an in-service for the ED staff. Our second cycle was focused on education and resources. So we hosted cart rounds for 2 weeks and aimed for 100% participation by all staff. Cart rounds were an interactive education among all shifts with collaboration of quality members and the educators. Part of PDSA 2 was also to identify champions within the ED department to serve as go-to for troubleshooting. Our PDSA 3 was ongoing education. So we uploaded a newly developed competency module to HealthStream to assign all our nurses staff to, and then we were going to use that same education to assign at higher and yearly thereafter. So this new competency module included an instructional video to demonstrate a culture collection technique. And then our last PDSA cycle was sustainability. So how can we make this sustainable? So we wanted to streamline the follow-up with the weekly contamination report. So we get contamination report on a weekly basis from the lab. And so we wanted to make sure that the follow-up was being done with every staff that showed up on the report. So I'm going to summarize our results. So as of Q2 2023, and I wanted to make note of that, the poster that you have available only shows data up to the end of 2022, so I'm giving you updated results. So as of Q2 2023, the quarterly blood culture contamination rate and the ED decreased to 3%, so we have met goals. Although monthly rate remains variable. The interventions that we targeted were primarily to the nurses staff, as they've been historically the stakeholders responsible for the highest rate of contamination samples. Some of the lessons learned was that we did not get to 100% of health stream use, mandatory health stream use by all nurses. Another lesson learned was that frequent PDSA cycles are needed while striving to build a strong self-sustainability process. And one of the issues we have with that is that we have a lot of our emergency department turnover in staffing. It makes sustainability of the projects a challenge. And so this new process had to frequently be reintroduced to new staff as we had new staff join our core group. And finally, we know that the ED will require constant maintenance and repeated PDSA cycles to continue to drive education on proper collection technique. That was it. Thank you.